Hi, I'm Dr. Lena Qazi, a board-certified family medicine physician, and you're watching the FemHealth channel. Unfortunately, there is a well-documented bias towards obesity in medicine. This is often referred to by the medical community as weight bias. This weight bias can show up in several ways, and it can negatively impact both patients and healthcare providers. Let's take a look at some of the factors that are involved. First, there are stereotypes and assumptions. Healthcare providers may hold negative stereotypes about people with obesity, incorrectly assuming these patients are lazy, lack willpower, or are non-compliant with treatment. These negative assumptions can influence how patients are treated. There's also stigmatizing language. Some healthcare providers may use judgmental language when discussing weight. This can be very discouraging for patients and can create a barrier to open communication. Open communication with your doctor is an important part of healthcare. Inadequate resources can also be a part of weight bias. Healthcare providers may feel less equipped to address weight-related issues due to a lack of training or resources. It's important to see a doctor who has experience in treating patients holistically. For example, examination tables, gowns, and other medical equipment may not be sized for patients with larger bodies. This can cause discomfort and can also hinder proper examinations. So what are the potential consequences of weight bias? Unfortunately, weight bias can mean that patients may avoid seeking medical care due to fear of judgment or discrimination. Weight bias can also lead to delayed diagnoses of unrelated health problems. Finally, patients may feel discouraged about weight loss efforts if they experience weight bias from their healthcare providers. So how can we address weight bias? First of all, it's important that there is an increased awareness among healthcare providers to reduce weight bias. Unfortunately, many providers do not even realize that they're exhibiting a bias. Secondly, medical education needs to incorporate training on weight bias and effective communication strategies for weight management discussions. Thirdly, up-to-date information is important. The world of weight loss is changing rapidly, with many new treatments becoming available. Both healthcare providers and patients should be on top of these changes. There are other videos on the channel about new advances in weight loss. Finally, creating a more inclusive healthcare environment with accessible facilities is a great way to send a positive message to patients of all sizes. By doing these things, we can make strides to reducing and hopefully eliminating weight bias in the healthcare system. Hope you found this helpful. Don't forget to subscribe below, and I will see you next time.